Welcome back, everyone. Dr. Dennis Morris is with us today. He's the Chief Medical Officer at Lima Memorial Health System. We're talking a little bit about getting an update on the coronavirus situation. I know obviously the Delta variant has hit hard across the country, as has another one now that's hitting the streets. Give us a sense of where you guys are at the hospital, what you're seeing in the patient numbers and those kind of things.
Well, definitely we're seeing a large increase in our patients presenting to the emergency department and our admissions with the Delta variant. We basically have a second surge here, and the numbers are approaching or exceeding what we saw last January when we had the surge back then.
Has it affected, I know early on when things were going, you kind of monitored as far as visitors to the hospital and how many people could get there. Are we back to that level again? Have we had to make some changes there as well?
Well, we have not reinstituted any restrictions on visitors as of yet, but we are currently monitoring that. We also know we have flu season coming up, and so we may have to impose some restrictions on visitors like we did previously. We also continue to monitor our elective surgeries, not so much because of bed capacity, but because of staffing.
I know that sometimes we sound like a broken record because we talk about the vaccine and we talk about testing and social distancing and masking and those kind of things, but are some of those same rules, do they still apply? Is that how we prevent the spread?
That's all we have available. And so, yes, I would encourage everyone, if you haven't been vaccinated, to get vaccinated. Definitely the people we're seeing in the hospital overwhelmingly are non-vaccinated people. Doesn't mean that there aren't some breakthrough infections, but even in those, the people who have been vaccinated tend to have less severe symptoms. And then masked more and more now with the weather. As fall approaches, we'll be indoors. So masks are important, social distancing, and hand sanitation. Same things that we've done for the past year and a half now.
I often think that social media has not helped the cause because of rumors and lies that get spread, I guess, about the vaccine itself. But talk about the safety of the vaccines and what you know about its efficacy.
Well, you're right. There's been lots of misinformation that's only contributed to our struggles, but the vaccine overall has been very safe. Yes, there has been an occasional report of some sort of a reaction to it, side effects, but by and large, very safe and very efficacious, about 95% or greater. And again, the people that we appear that maybe didn't get the best immunologic response are those that were already immunocompromised. And that's where the discussion's coming up about a booster for them. But overall, it's been very safe, very effective. And again, even those people that come down with the infection after having the vaccine, their symptoms tend to be much less severe.
Yeah, I think people too start to, after a while, I think we're in our fourth wave of it now, they start to get a little weary of dealing with this. But as you said, a lot of it's basically going back to basics as far as some of the tips you mentioned. Is that the takeaway from this?
You're right. And as long as until we get a better vaccination rate out there and a better immunity, we're going to continue to see these waves. There's no real end in sight. And as you mentioned earlier, there is a new variant that's out there, and there'll be more variants in the foreseeable future. So the battle is far from over, and we continue to see people need severe or major intensive care. People continue to die from this disease. So it's not over.
For those who hear this and want to finally get their vaccine or get vaccinated, what would you tell them? What advice would you have for them?
Well, there's plenty of resources available. Certainly, we have an 877 DOC LMPC number that they can call and get scheduled. It's available through some retail pharmacies. You can get online through the Ohio Department of Health and schedule a vaccine. So it's out there. There's plenty of availability. There's no shortages like we experienced early on. And so just encourage people to get one of these facilities lined up and get vaccinated.
As you said, plenty of options available. Dr. Morris, thank you for the update. We appreciate it.
Thanks for having me.
You bet. Nice talking with you. We'll be back right after this.